Good afternoon, and thank you for joining us for this emergency climate and health action briefing. Earlier today, we held an emergency press conference to announce my government's ambitious and essential policies to tackle the climate and health emergency. We are holding this second press conference outside the Department of Food, Environment and Rural Affairs to emphasise the key role that policy in these areas will have and the ability to successfully avoid the worst impacts of the climate crisis while protecting the health of the UK population. Our policy will be led by scientific and medical expertise and will be informed by the public. So before I announce our policy direction, we will hear from the Chief Medical Officer and our patient perspective representative. But first, our Chief Scientific Officer.
Thank you, Prime Minister. The environmental impacts of our current agricultural sector are unsustainable. First, emissions. Animal agriculture is responsible for 33% of all global greenhouse gas emissions, yet the UK farming sector uses 85% of our farmland to produce only 32% of the nation's calories. Second, pollution. Farm waste from intensive animal agriculture, including feces and synthetic fertilizers, is polluting our land, air and waterways. Third, human sickness. The widespread use of antibiotics within intensive farming increases antibiotic resistance. The crossover of resistance into germs infecting humans poses a real threat of a post-antibiotic era in which infection deaths will skyrocket. If we want our children to inherit a planet on which they can survive, let alone thrive, these practices cannot continue. Farmers have delivered what they've been asked to deliver. Our challenge now is to use our scientific understanding of the problems we face to support farmers to produce food in a manner which will benefit us all. Our next speaker, the Chief Medical Officer, will cover the impacts of our current diets on the health of the nation.
Thank you, Chief Scientific Officer. The way that we eat and produce our food is fundamental to the health of individuals, their families, and our societies, but also to the health of our planet. Conditions such as high blood pressure, diabetes, obesity, high cholesterol, and even inflammatory conditions such as arthritis are all caused by unhealthy diets. In the UK alone, excessive consumption of red meat and dairy is linked to 42,000 deaths each year. And around 70,000 deaths are associated with insufficient intake of nutritious plant-based foods. From my perspective, as an A&E doctor and a general practitioner, this number is significantly higher. Simply put, our current way of eating is harming our health, our children's health, our environment, and the planet. It is not sustainable, and it cannot continue. Yet, a different approach is possible. An international team of experts have developed dietary recommendations called the Eat Lancet Diet that could dramatically reduce diet-related ill health, reduce the environmental impacts of food production, and provide a sustainable, healthy diet to a growing global population. It is our duty to guide people to choose food choices that are healthy for themselves and for the planet. I will now hand over to our patient and public representative.
Thank you, Chief Medical Officer. Many of us have felt alarmed and powerless in the face of the power of the food industry as it has peddled and pushed ever more harmful foods to our children. The completely unsustainable impact of our agricultural industry on our health, on our environment and on our climate have been concealed from the UK population so that a small number of individuals can continue to make a profit from our ill health and from the destruction of our planet. I'm so thankful that today we can begin to hope that practical, honest and urgent steps to protect the future of our children will be taken. Thank you.
I thank all my advisors for their reports. To date, we have not done enough to support our farmers, to protect nature and to increase UK production of affordable plant-based foods. While many of you struggle to feed your families, let alone eat healthy diets, we have shamefully placed corporate interests and the profits of the super rich over the health and well-being of our population. And this is unacceptable, and for this I am truly sorry. Today we are making a series of emergency pledges, which are all based on scientific, nutritional and climate evidence, and all which have fairness and public health at their core. These include a transition away from meat and dairy subsidies towards targeted horticultural products, a rapid transition away from intensive farming in order to minimise antibiotic use and improve the quality of life for animals, reallocation of targeted pasture lands for nature restoration, the prohibition of pesticides, fertilisers and chemicals which are ecologically harmful, use of government buying power to guarantee contracts for healthy and delicious UK-produced plant-based meals in the NHS, prisons, schools and government facilities, a ban on advertising for the most harmful foods and an increase in taxes for meat, dairy and ultra-processed foods, implementation of a national food strategy and plant-based action plan that is free from food industry influence and which will have food affordability as a key priority. Finally, we will update the Eat Well Guide to bring recommendations in line with international guidance and increase public education on healthy eating. As a result of these policies, we anticipate a growth in our farming sector with greater subsidies, an increase in farmers, land workers and nature conservationists, and an increase in the percentage of domestically produced food. Thank you all for your time. We will continue to keep you updated with the climate crisis and all we are doing to combat it. Thank you very much.